Maternal smoking continues to be an important issue in the United States despite overwhelming research of the harms that can be inflicted on mothers and babies by tobacco smoke. Approximately 1,000 babies die each year related to smoking during pregnancy because without sufficient oxygen, babies are unable to properly grow. Smoking while pregnant can lead to long-term problems as well, including learning disabilities, more frequent illnesses, and more physical growth problems. Non-smoking pregnant women tend to have a higher education, higher income, have multiple children, prenatal care, and if previously smoked fewer cigarettes per day, while smoking pregnant women tend to have a lower education, lower income, mental health disturbances, a lack of support, and a higher nicotine dependence. In 2016, 7.2% of women who gave birth smoked cigarettes during their pregnancies. Also in 2016, there were 3,941,109 births in the U.S. So to give some perspective, this means that approximately 275,877 children were impacted by cigarette smoke while in utero. This image from the CDC shows that West Virginia had the most significant results, with 25% of their total pregnancies impacted by cigarette smoke. Other states with high numbers of smoking mothers included Kentucky, Montana, Vermont, and Missouri. According to the American Lung Association, there are approximately 600 different chemicals in a cigarette, with 69% of them causing cancer. When a cigarette is lit, it can release as many as 7,000 chemicals. So, even if it's one cigarette, when a pregnant mother inhales a puff of smoke, these chemicals are absorbed into her bloodstream, which is shared with the baby that she is carrying. According to the CDC, there are many reasons to avoid smoking during pregnancy, including preterm delivery, low birth weight, and sudden infant death syndrome. So why, with so much research, are women continuing to smoke while pregnant? Tobacco is known to be an extremely addictive substance, and in order for women to quit, they need to believe that the risk outweighs the benefit. Some women may think, my mother smoked while she was pregnant and I turned out okay. But we need to address these beliefs, because 1 in 5 babies born to mothers who smoke during pregnancy have low birth weight, leading to longer hospital stays and the risk of long-term complications. Myths versus facts. If I quit smoking during my pregnancy, it can lead to poor outcomes due to fetal stress. This is a myth. Babies will not be stressed by a lack of nicotine. Rather, they will benefit from an increase in oxygen. Smoking tends to be passed on from generation to generation in families. This is a fact. Although smoking rates have been slowly declining in the U.S., children with smoking parents are at an increased risk of developing the habit as well. Therefore, it is critical in the health of these babies that the chain of habit is broken. I have already smoked during this pregnancy, so it doesn't really matter now. This is a myth. Quitting at any time during a pregnancy is beneficial to mother and baby. Smoking cessation at any point will decrease the risk of low birth weight. According to a study by Ashford and Rayans, mothers who smoked or were exposed to secondhand smoke were more likely to believe that if their baby had an abnormality or health problem, that it was related to nature or uncontrollable circumstances rather than their own actions. Therefore, women must be educated about the truths and myths of smoking during pregnancy and empowered to quit, knowing that their decisions and their actions change the health of their baby. Talk to your loved ones, talk to your friends and your community about how smoking cessation can change not only their lives, but the lives of their future generations.